Welcome back to the Special Good Day PA. We've been talking about Penn State Health's spine robot, and you've heard how it can benefit patients. So let's meet one who has directly benefited from it. Christina Butler is back to introduce us to her. Christina.
Hi again, Amy. Colleen Elias had her surgery in June. She's amazed at how quick her recovery has been. She puts her full trust in the neurosurgeons at Penn State Health, so much so she was excited and not the least bit nervous to be the very first spine robot patient there.
Well, we went to the beach for 4 days in North Carolina.
Oh, yeah.
The steps are just like straight up and down.
Colleen Elias and her neurosurgeon, Tim Ryder, have a good camaraderie.
He's a great surgeon. He's very meticulous. He takes his time.
Today, she's here for a checkup.
Okay, so here's our x-rays from today.
Just 4 months ago, she was on the operating table.
This is my 4th back surgery. Mostly little things, decompressions in the low spine. And my symptoms this time was, they were a lot of leg pain, leg weakness, and my gait.
She had a repeat laminotomy, which is to decompress the nerve roots, and we did that on both sides, and then a posterior fusion. Basically the disc, the joint at that level is moving too much, so we wanted to take the motion away from that joint, and that's what the fusion is. Before the surgery, when I signed all the papers, he had a plan. He had 2 plans in his mind of what he was going to do because he didn't think the new equipment would be here in time. I was in the pre-op getting ready for the surgery, you know, the IVs and all that hustle bustle, and he walks in to mark your area where the surgery is going to be, and he had this big grin on his face. He said, "Guess what came?" And that's how we found out. I was excited because I knew that the outcome would be probably much better than the regular way of doing things. I was laying on the table waiting, and I got to see the robot, and there were 4 techs from the company there, and they explained the whole thing, showed me the big monitors, and it's like something out of a science fiction movie, really. So we were able to take a preoperative CT scan, make a 3-dimensional model on the computer, and then using that model, we can then register that to her laying on the operating room table, and we could point to her spine, and it'll show us on the 3D model where we are. When you're in the OR, the CAT scan, it gives you an updated picture of everything, so they know exactly what to work with on the spot. It was a redo procedure, so the anatomical landmarks weren't all there because we had taken some away, but everything registered well. The CT scan was perfect. We made the 3-dimensional model. We knew exactly where we were, and in her case, we were placing the pedicle screws. It gave us that exact trajectory to put that screw right in the bone where we wanted to be and stayed away from the nerve roots, and she did great. The recovery, I am a firm believer that it's quicker. It's quicker. I think you have less soft tissue damage, and that robot just guides the surgeon. He uses the software, and I think they're more accurate with where they're placing the hardware and things like that. I had very little pain post-op, and it was only a few days, and my walking was back to normal. The funny gait was gone.
A quick recovery after years of pain. Today's checkup.
Nothing looks loose, screws aren't loose. Everything's in good position. Actually, it's pretty well lined too. Look how well lined that is.
Another sign to Colleen, the spine robot got here just in time.
Yeah, let's see you touch the toes. I don't know if I can touch my toes. Look at that, impressive.